Heart failure is the heart's inability to pump enough blood to meet the demands of the body. And in this video, we will identify 6 good general practices for when exercising with it. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'm going to provide exercise advice for people living with heart failure. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Heart failure does not mean your heart has stopped pumping. It just means that it needs some support to help it function better. This condition is normally associated with a weak or stiff heart muscle. It's not something that can be cured, but the symptoms can be managed for many years. These symptoms include breathlessness, feeling tired or exhausted all of the time, swollen ankles or legs, and some people experience a persistent cough, a fast heart rate or dizziness. There are risk factors that can lead to heart failure, such as coronary heart disease, high blood pressure, cardiomyopathy, heart arrhythmias, and damage or defects to the normal workings of the heart. Although medications and other invasive interventions can help control the symptoms, regular exercise as part of a healthy lifestyle can also play a key role to one's quality of life. If you're newly diagnosed with this condition or have it but haven't undertaken any exercise for a while, then you really should investigate starting a structured cardiac rehabilitation program in a clinical setting. A team of cardiac specialists will lead this type of program, and they'll be able to provide you with the tailored support that you will need to get you more active in a safe, controlled environment. So please check with your doctor or general practitioner first to find a way forward with this, as it will be invaluable to you in the long term. However, if you understand the condition and how it affects you and your heart failure is stable, then here are some tips to help you manage a regular exercise routine. Number 1. Be incredibly vigilant about monitoring your symptoms before, during and after exercise. Look out for changes in shortness of breath, excessive fatigue, body weight, blood pressure, heart palpitations or swelling of the ankles, as these may indicate a change of left ventricular function or the ability to pump the blood around the body effectively. So anything like this will require an evaluation from a cardiac specialist. Number 2, warming up and cooling down should be done for prolonged periods of time. This is 10 to 15 minutes for each element, but carried out at a much lower intensity to reduce the risk of disturbances in your heart rhythm. However, if you're just being more physically active, like taking the dog for a walk, doing some gardening or going shopping, then you can do this at a pace that you can manage, taking rest breaks where required. Number 3, to help maintain a good blood pressure while exercising, try not to stand still. Keeping the feet moving, even if it's some low-level walking on the spot while doing an arm exercise, will help keep the blood flowing and prevent you from feeling dizzy. Even if you need to sit down to rest, try and keep the feet moving with some ankle pumps. Number 4, although moderate intensity endurance exercise is generally safe and beneficial for people with heart failure, it is possible that you may not be able to sustain standing exercises for a long period of time. So in some cases, adapting the exercises so they can be performed seated may be an option. In addition, some people may tolerate shorter exercise periods interspersed with periods of rest rather than continuous steady state exercise. Number 5, while exercising, it's important to keep the rate of perceived exertion scale in your mind to monitor how breathless you feel to gauge your work rate, as target heart rates are not recommended for people with heart failure. During the warm-up, which should be slow and steady, you should aim to move from a 1 to a 2 on this scale. During the main exercise component, this can move to a 3 or 4 in a range that you can manage where you feel a little bit more puffed. And then during the cool-down phase, you should aim to reduce it back down from a 2 to a 1. Finally, number 6, although resistance or strength exercises have been proposed to prevent muscle wasting syndrome, a common byproduct of heart failure, isometric exercises, this is placing demand on the muscles without moving, should be avoided to reduce the risk of arrhythmias and other hemodynamic changes. The Valsalva maneuver, this is attempting to exhale out of a closed airway, should also be avoided for the same reasons. I have done a cardiac rehab exercise video that some people living with heart failure may be able to follow as a form of home exercise. So if you want to take a look at this, click on the pop-up banner above, or I'll leave a link in the description below. If you prefer a lower level seated exercise routine to try out that's far less demanding, then I'll also leave a link in the description below for you to check out. Remember, above everything else, carefully monitor how you are feeling, and any unusual changes to your symptoms or how you're feeling generally should be reported to your doctor. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel, or click here to watch a recent video. See you soon.